Somehow the video is not working from my end, but thankfully the audio, bilateral audio is okay.
Yes, sir. Yes, sir.
Yes.
So we are going live now.
Sure.
Welcome, everyone. This is Harshal Desai from Elit's Technomedia Private Limited. I welcome you all to this panel discussion today happening at Healthcare Transformation Summit. Uh, the subject, the panel discussion subject for the panel discussion is COVID-19, how it paves new stars to telemedicine. And we have an eminent panel, several experts from different domains joining us here. We have Dr. Rajesh Harshvardhan. He is Head Department of Hospital Administration, Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow, and Medical Superintendent cum Executive Registrar, Super Specialty Cancer Institute and Hospital, Lucknow.
Good
Welcome,
afternoon to all
Dr.
of you.
Rajesh Harshvardhan.
Good
We
afternoon to all of you. Yeah.
we have Dr. G.V. Divakar, Managing Director, Divakar's Specialty Hospital. Welcome, Dr. Divakar, to this panel.
Yes.
We have also been joined by Mr. Sachin Grover. He is from Phoenix, India. Thank you so much, Sachin, for joining us. We have Dr. Alok Rai, Chairman and Managing Director, Medica Super Specialty Hospital. Thank you, Dr. Roy. And we have also been joined by Dr. Marvin Leo, Chief Operating Officer of Aware Gleneagles Global Hospital. Welcome, Dr. Leo, to this panel. You're on mute, Dr.
Yeah,
Leo.
yeah. Hi. Good afternoon, all to the panel.
So I believe that one panelist will wait for Dr. Madhukar Gaikwad also. He is head of medicine unit at JJ Hospital. We'll wait for him. Uh, he joins. So we'll start our panel discussion. Once again, welcome everyone. COVID-19 paves new vistas to telemedicine. This is the subject for today's conversation. And we all know the use of tele health has surged in manifold with COVID-19. In this panel discussion, experts will explore the potential of telemedicine and will give us in-depth insight about the different facets of digital solutions like teleradiology and capacity building initiatives. Apart from it, they will also deliberate upon the challenges in virtual care and how doctors are handling the electronic records that enable doctors to access patients' health histories remotely. Thank you so much, everyone. We'll start with Dr. G.V. Divakar. I would request you to, sir, please briefly share your opinion on this subject. In about 2 minutes each, we will request you to share your opinion, your views on this subject, and then I'll request everyone to answer the questions that we have. So, Dr. G.V. Divakar, your views on this subject.
We all know this COVID-19 pandemic has brought this telemedicine and virtual consultations into full stream practice because when the patient, this is both helpful for the patients and for the doctors to reach the patients because when this lockdown or closed down was there, patient not be able to come to the hospital and they can't bring the records like that. So this is more helpful and the amendments which has been brought through to this telemedicine laws is quite helpful in progressive in nature, which will be good for the further progress of this telemedicine usage. There is a huge potential in the use of a digital platform for reaching healthcare to where it needs to meet. So undoubtedly, the telemedicine guidelines are welcome move. This transformation in the healthcare sector would have eventually happened in the country, but the COVID pandemic has triggered it. The accessibility is also hastened because of the necessity and safety. Safety and cost effectiveness are the horizons for the reaching out are certainly the advantages. Further, the amendments which may come in the future after observing all this, what the problems can occur in the future, we'll be able to discuss after we document our experience and learn our lessons in the next few months. Thank you.
Thank you so much, Dr. Divakar. I would request now Mr. Sachin Grover, Philips India Limited, to share his thought on this subject that we have today for the panel discussion in brief.
Sure. Thank you, Harshal. I think if I reflect on the digital journey, right, and what are the challenges we've had in past around reaching or giving access to the remotest areas, the COVID situation has absolutely speeded up the process of adoption of new technology and using that technology. I think more and more new startups as well as newer organizations are looking at how to provide that access, right? And if I call out some of the areas which have been very dramatically affected because of the COVID situation, one is mother and child care. So think of situation where in the remotest areas, the mothers used to come in to community health centers or to primary health centers. They're not able to do that now, right? So that section has got left out. Now we need to think of how can digital health, how can telehealth actually help? And there are more and more people coming up with newer ideas to provide that support. Similarly, in COVID situation, one of the big challenges that we have seen with the hospitals is around infection of the clinicians themselves who are in the ICU. Now, with that situation, you will always feel that there are 2 or 3 intensivists in the ICU. If 2 of them get infected, you will not be able to operate on the ICU at all, right? And that hinders the care. There again, how can a tele ICU come in to provide support even in the COVID-19 situation? I think these are important things which have come up, and we see more and more people adapting to it and hastening the entire process.
Thank you so much. Thank you so much, Mr. Grover. I would now request Dr. Marvin Leo to please share his thought on this subject in brief.
Yeah, hi, good afternoon, all, and nice to have this conversation initially. Telemedicine, it didn't happen today. Actually, in 2001, ISRO, along with Apollo Hospitals Group, had launched this program in a remote Chittoor village where remote accessibility of healthcare is available for that village. It all started there. Then all the other software technologies and other companies started pitching in for this telemedicine. And today, where we are, as on 15th August, our Prime Minister Modi had come up with a National Digital Health Scheme where we are going to digitalize all the information of health parameters of an individual, may it be a drug, may it be a laboratory investigation report, all are going to be linked together in a single platform so that a doctor or a healthcare worker who has the login ID and password can easily view the parameters of the person who is coming for a consultation. So this can happen anywhere in any part of the world. Say, for example, today in telemedicine, one advantage is that a doctor sitting in a city can access his patient remotely in his village or even abroad. So now that is the second level which we are going to see. So mainly the players which are already playing, with this healthcare softwares and software, implementation, are finding slightest challenges. Like for example, during this COVID pandemic, what's happening is with telemedicine, the first day of fever or third day fever, we give the telemedicine, and the patient doesn't contact us the fourth or the fifth day, where they are worsening and the lungs are being eaten up by the viruses, and then they land up to a hospital in a very critical condition. There are few challenges also into it, but overall, telemedicine is going to support the coming up generations for the healthcare industry, which is very, very important. And AI, which is also going to be a major partner, and now Google and other uh, software giants are coming up with AI invented, diabetic retinopathy and other diabetes disorders or hypertension disorders. They're coming up with AI predictions. So predictions also can help and suggest doctors that this patient might land up into this, so that we have to be, always prevention is better than cure. So prevent such diseases also. So nowadays the telemedicine is coming up to the next level, and we are going to see further developments in future.
Right. Thank you so much, Dr. Marvin Leo. I would now request Dr. Rajesh Harshvardhan to share his thoughts on uh, how COVID-19 is paving the vistas to telemedicine. Dr.
Good,
Harshvardhan.
af- Good afternoon to all of you. I hope I'm audible to you all.
Yes, sir.
Uh, as the keeping the context intact, the COVID 19 and the way it's impacting telemedicine, I think the way I would like to look at it is from a couple of perspectives. I mean, from the perspective of healthcare provider, from the perspective of healthcare seekers, and from the perspective of healthcare managers. Let us look at it from three perspectives, and again, then I'll dissect it. Subsequently, globally, how it's going, what shape it's going to take, and the way it evolved. Then we'll come zoom into our own country, the way it is unfolding in our country. Then I'll zoom in further to look at it from the three-tier healthcare organization that our country has: the primary level, the secondary level, and tertiary level. Let us look at it from these perspective in a trilemmal approach, that is the triology of healthcare providers, seeker, and managers, then the global, national, and local regional perspective, and as per the three tiers of the healthcare delivery, that is primary, secondary, and tertiary. Let us travel back in time very quickly for a couple of seconds. So it is like it began with teleconsultation. It was not telemedicine exactly, with
Mhm.
teleconsultation, which gradually evolved in the West to the extent of telemedicine. And now, at this point in time in West, it is there's a complete integration of the technology intensive and technology driven healthcare delivery or healthcare industry in the West, where it has been intertwined with the upcoming technology, which someone said right now is artificial intelligence or neural network, and many other things are converging together. And at the same time, availability of the internet and accessibility and penetration of the internet, which has become, it is far and wide. So a technology or a tool or a technology driven tool is now accessible in the remotest corner of even our own country. So that is one big advantage of it.
Mhm.
Second thing second thing is, when you come we come little more of age, that in our country, apart from few locations in South India and the few hub and spoke model of corporate hospitals, the telemedicine is primarily teleconsultation, not telemedicine as such. It's teleconsultation, and the same is constrained to few domains only. Only few domains, few select domains, and it very regimental and protocol based, as much as I have seen and witnessed. And I also, because I'm able to tell you all this, because in the entire for the entire country, we have the National Nodal Telemedicine Center at SGPGMS Lucknow, which is the only national nodal center for telemedicine in the entire country. And we see it from close quarters, and we have got connectivity with uh, uh, another whole world. We have got European network, we have got US network, we have got sub-Saharan network, we have got SARC country network. So what all, I mean, our teaching program, capacity building program, training programs, and interventions like surgery, other things, they are we have a structured regimental system of sharing our knowledge and the way we deal or the way we care with the world. But it is more of capacity building than rendering treatment. So for rendering treatment, couple of pilot mode things are going on pilot mode, which is primarily teleconsultation, is not telemedicine, when you are doing we are going to do everything. Second thing that we are doing in, now I'm zooming in further from the perspective of the state of UP, though it holds true for the country as well, that Government of India has launched PMABJY, Pradhan Mantri Ayushman Bharat Jan Arogya Yojana, and this Ayushman Bharat scheme has got four components. One component is establishment and commissioning of wellness centers all across the country, and there will be 12 components of healthcare delivery. There were 12 parameters to be delivered through those wellness center for all those who are in need of. And the CHOs, the community health officers, who would be manning those wellness centers, would be connected to a hub at PGI SGPGMS Lucknow, I'm the nodal officer for this the Ayushman Bharat Yojana at SGPGMS Lucknow. So what we are doing, or what we have been told to do, and we are actually on the job, that we would be given couple of districts, and all the wellness centers in those districts, and all the CHOs manning those wellness centers in all those districts would be connected through telemedicine network through our center, wherein they would be accessing the super specialty and super specialty consultation over this network. It will flow bilaterally. They can exchange heavy files of investigation and films and other things, and we will provide consultation to them. So it is one more step forward. And since the backdrop of your this webinar is COVID-19 pandemic, let me share you how we are harnessing the telemedicine here at SDPGIMS. Since the point in time when the government of UP has mandated us to become a state level COVID hospital. So as on date, we are running a 210 bedded RCS Rajdhani COVID hospital in the state capital of Lucknow, and we are catering to the entire range of services that is required for the COVID patients diagnosed with COVID-19. And we are using this telemedicine or teleconsultation and this technology in many ways, which is actually helping, which I told you in the very beginning, to all the three: the healthcare managers, us, the healthcare seekers, patient, and the healthcare providers, the doctors and paramedics. I'll let you know a couple of examples. We are running a COVID command center under my own department, Department of Hospital Administration. It's running round the clock there in the Rajdhani COVID Hospital RCH at SGPGIMS, where our residents who are postgraduates, they are manning this COVID control center, and it is again telelinked, so I can monitor it. Second thing is there's a structured tiered system of monitoring what all is happening inside the this COVID hospital of ours at SGPGMS Lucknow. We are harnessing the telemedicine network. And third thing is that we conduct virtual rounds. Senior doctors, senior most doctors, or senior administrators, we can take virtual round of the hospital. We do it from our perspective, from administrative perspective, from managerial perspective, and clinicians do from their perspective. So this is the third thing that we are doing, and how we are harnessing the potential of telemedicine in times of COVID pandemic to make clinical care more safer, because
Yeah,
it
great.
it avoids the or it it uh, it 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 obviates the need of direct interface. Second part we are doing is we are running the tele OPD. We have commissioned tele OPD. So the conventional OPDs are constrained very much, and currently we have been running the tele OPD since March end or April beginning onwards, and we are it's doing really well, and we are also offering teleconsultation through our ECCS clinics. So the the entire spectrum, the entire canvas, the has been changed to adapt and to adopt
Hmm.
both as per the need and in tune or in sync with the changing tunes of the time. The healthcare, the way healthcare is to be delivered in times of tremendous contage, tremendous degree of the how contagious the disease is. So keeping that in mind, it has really helped us to serve clinical care better, to manage or administer better, and in fact patients are also satisfied because then we interview them as well for as a feedback to complete to close the loop. So to summarize this teleconsultation or the telemedicine or the technology when we are using the bilateral audio visual communication is helping us render safer COVID care, in particular in today's time, and a far a healthcare delivery which has a reach of which can outreach to community far and wide
Hmm.
beyond the domains of the physical distance, so as the experts and super experts are able to reach out to the people in community by using or harnessing this technology.
Yes, thank you, sir. Thank you so much, Dr. Harshvardhan. I'll now request Dr. Alok Rai, CMD Medica Super Specialty Hospital, to share his views in brief on the subject first, and then we will ask questions one by one to all panelists. Dr. Alok Rai.
Thank you. Thank you, Mr. Desai. All my colleagues have expressed their views about telemedicine. There's nothing much to left to say, but what I would like to say that telemedicine is a process where the consultation is initiated by a patient or by a practitioner to consult or provide treatment distantly. It is not. It need not be always video based. It could be audio based. It could be text and facts also constitutes telemedicine. The very fact government of India, though telemedicine has been going on for 2 decades, as Mr. Leo has mentioned, but the very fact that government of India, along with Niti Aayog, the Council of India, has come up with a document where it has been authorized and it has been in a way legalized. It has made it possible to consult without any fear or worry. Earlier, we couldn't do it. Earlier, a doctor could not consult legally. It was there, it was present, but it was shrouded in a way that we are giving him some advice. We couldn't prescribe medicines and transmit. Now, all that worry has been taken away. There could be a primary consultation, there could be a follow up by adopting any means, audio or video, whichever means you like it. It can be consulted, and it's a time and distance insensitive. You can consult anywhere in the world, anywhere in the locality, next door or across the country. So the very fact that it's a time and geographical insensitive. Now, what I want to bring about, which my other colleagues also have mentioned, that it brings a kind of earlier, it was only meant for consultation. Now it has brought in a factor of safety. It's a safe for healthcare workers to initiate a consultation process and treat without getting affected, which has been brought out very well by the COVID-19 pandemic. Earlier, it was for a convenience or for a distance. Now it is for a safety, which we never thought earlier. So the very fact that telemedicine has brought in the safety for doctors. A lot of patients don't want to come to the hospital not because they don't have access to the hospital. They cannot reach the hospital. They don't want to come because they're scared. And doctor doesn't see patient because he's also scared to see them. So telemedicine has brought in a kind of safety for doctor and patient both to consult, get treated, get followed up without falling sick because the consultation or because the fact that he has to travel and meet. So that's the one factor which has really come up very well. And this safety aspect is very clearly demonstrated in the hospitals. Now the referral, earlier doctor is to come to the ward, ICU or HDU to see a patient if he's referred to, like a cardiologist, a diabetologist, a nephrologist, will have to come to the ward physically. But with the help of telemedicine, that physical visit, which is very cumbersome in the era of wearing PPE and going to the hospital, going to the ward to see another patient is very cumbersome and very expensive too. Whereas telemedicine is very inexpensive and at the same time very safe for the doctor and patient both. So that aspect also has brought in. And I don't know, it's really not a very fortunate event to have a pandemic. But for telemedicine, it has been a rediscovery that digital is a way to go. So telemedicine is a way to go. Thank you.
Yes. Perhaps that is the reason, even the Ministry of Health and Family Welfare and Niti Aayog, they have now come up with the telemedicine guidelines, right? So, next question is to, I'll first ask Mr. Sachin Grover, how do you see this move where the government is coming up with telemedicine guidelines, and what will be the immediate impact and the advantage of it? What further improvement by way of amendments is required in this? Sachin Grover, you are on mute.
Hi, sorry. Thank you for pointing out, Harshal. So I think it's a good move by the government to come up with a policy around digital health. It clearly calls out a standardized way of approaching this telemedicine, right? If you go back 2 to 3 years back, people would be following a telemedicine route through either a phone call or a WhatsApp calls or through their own private applications, right? Now, with this policy coming out, you can clearly see that the roles and responsibilities, or also the on a legal front, right? Who has a medical legal liability? All of those things are getting clarified, and it becomes quite easy to adapt for everyone, right? There is no dichotomy in terms of whether I should follow one path or the second path, whether it is safe for my doctors or not, whether it is safe for my patients or not. Am I doing the right thing? Am I in within the legal frameworks, right? I think those questions have been resolved through this guidelines which have come in. I think as we go into the future, there would still be some more revisions that might come in as the telemedicine field evolves, with more and more private players
Mhm.
coming up with newer innovations. What I believe is, when the expanse increases and it goes beyond teleconsultation, and it actually breaks some barriers, then we might expect some more guidelines to come in. For example, tele ICU, there are certain guidelines there, but it's not uh, completely laid out, right? So that is a learning journey, but it's absolutely a good first step to standardize the
Right.
care.
So we have all the hospital people who are heading different hospitals here. So Dr. GV Divakar, what are the steps that you suggest that can implemented to the right people are available on this platform whenever you are providing as a hospital head, whenever you are providing the telemedicine or teleconsultation to patients? What are the measures that you suggest? If you can tell us, sir.
So normally we have got in the hospital, we got an app, the Workers Hospital app, so that the patients can take the appointments and do the teleconsultations and discuss the reports along with that. So both for our doctors and our patients are well used to this modalities, and it will be a very seamless transition into telemedicine and consultation right from the end of March. The patients who would have said that they would prefer to face-to-face consultation or consultation or no face falling into in line with this behavior change, and are using this tele consultations through the hospital app, and have been they have been very satisfied. The Health Watch app is another additional feature for home monitoring in the COVID times. So
Hmm.
through these instruments, through the app, they can show us the reports. They can take our opinion. So like Glover told, since most of our patients are antenatal patients, are expecting delivery patients, they need not come all the way to the hospital. They can take the teleconsultations and take the suggestions from us. And only when it's required, they can come to the hospital for admission like that. So in this
Right.
way, for all this, the hospital app is one of the new innovations which we have made for the teleconsultation practice. Thank you.
Right. Right. Dr. Alok Rai, you mentioned that it's not just the telephone advice and suggestion on telephone, but there are several other mediums which can be used like audio, video, and now there are several tools available, mobile phone applications. So if you can tell us how you have done some kind of value addition when it comes to telemedicine and teleconsultation in your hospitals, and if you have trained your employees in that way that they can always add something new to this uh, mechanism. You're on mute. You're on mute.
Sorry.
Yeah.
Apology. The the very fact, the advantage of digital is that you keep on innovating. I'll give you a small example. We had a patient yesterday who's on ECMO, and their relatives are in USA, and we had set up a call. So it is a usual practice set up on a Teams or Zoom call. So Zoom call was set up, and somehow it crashed. So, but the medical board was half the way. So people didn't want to stop it. They went on WhatsApp, and now WhatsApp you can connect with the multiple speakers, multiple people, and it continued for an hour. Amazing. The very fact that there is a alternatives available. And what I would like to point out that this COVID, we learned a lot. In Bengal, the home quarantine is very common, but the government has said very clearly you can only be at home quarantine if you are linked with a hospital which is talking to you every day and checking on you. So this has given us an opportunity to go to the people's homes with the help of telemedicine using standard platform which is being provided by many providers across the country. There are many providers, Swast being one, and there are many providers in the country who have come up with a good teleconsultation. So we have used that, and in a day we have taken care of 400 patients, highest number in a day in home quarantine, which was unheard of. It was just not possible. So this has provided us a means of reaching home in a distant places, give the comfort, and you know how much psychosis and the fear COVID is generating in everybody's mind. The very fact that we could address that at home speaks volume about the possibilities of telehealth and telemedicine in future to come.
Right. This question is to the same question I would like to ask to Dr. Leo also. The value addition that you have done in telemedicine and teleconsultation.
So what I really feel is we are talking about telemedicine. Yes, I understand, but it's all about telehealth. How are we going to give health to an individual? So, various hospitals have various methods. They have started eICUs, they have started tele-ICUs, they have robots in place for temperature from the entrance till the end, and a lot of video consultations are happening. And in the ICU, off the ICU, patients can talk to their relatives in the ICU, in the ICU via videos. So, a lot of things are happening, and even counseling, the billing, everything is happening via videos these days because of the COVID. There are other viruses also which is picking up in this country, which this COVID is brought us everything together. But the initial days, I have to just get reminded of Mr. Alexander Graham Bell, who invented the telephone in the 18th century, and his first talk was, "Mr. Watson, please come in." Why he called Mr. Watson was he had poured some acid in his pant. So that's where we started telemedicine. Okay. So from that day till date, there's a lot of evolution which is coming up. So I just wanted to quote him because we should not forget from where we started. And today in this generation, in the 21st century, we are more towards app and other things. The youngsters from the age of say 12 to from the teenage till the age of 40, 45, 50, 55, we are app oriented and we have the modern technology. For example, if you take my grandmother who will have an iPhone but doesn't know how to use an iPhone, who's a 90-year-old or an 85-year-old or a 75-year-old, who stays in the remote villages, because they initially came from villages to city and we settled in cities. In the cities there won't be any issues on this, but in the remote villages, again, accessibility to care, right right doctor, right time, right place, right center, all needs to be in aligned, so that we have to have a definitive protocol and definitive software and definitive mapping. We should have a geographical mapping where the facility is available, where the nearest facility is available, where there's no facility available. All this needs to be geo mapped accordingly, and that is when this is going to see a success. See, from the 18th century we are evolving, but success is definitely a journey and not a destination. So this journey of success needs to be there, and geo mapping will help in future. I'm just talking on a broad base rather than a hospital centric and rather than a COVID pandemic right now. Pandemic is a pandemic and everybody is getting adapted to it, but on a whole overall telehealth, we should give care, prevention, geographical mapping for the hospitals, for the patients, for the digital health to have a very great definitive platform, and health to be provided for all. Health to be provided for all is the motto. So we have to geographically map. That's the main ambition or
Right.
motto where this should end.
Thank you so
That's
much.
all from me.
Coming to Dr. R. Harshvardhan, sir, you are you're associated with one of the very nominated hospital in Lucknow. So, do you think our doctors and the healthcare workers they are trained enough to do the right way of teleconsultation? If you can share your thought on this subject also, and then I'll also request you to share your thought on how do you think this NDHM will have an impact on telemedicine, Dr. R. Harshvardhan.
Uh, I would request you to please repeat your
Yes.
concern or
So,
question because there was a bit of interruptions in between.
okay, I'll repeat, sir. So the first thing is that what are your thoughts on how well our healthcare workers are trained enough to provide teleconsultation, telemedicine
Okay.
service to the
Okay.
patient, and what are the things that they should always keep in mind while providing this service to patient. This is the first question, and the second question is, how do you think the national digital health mission will have an impact on telemedicine? If you
O-
can please guide us on this in brief, sir.
Okay. So coming to your first concern, the degree of preparedness vis-a-vis healthcare providers. So again, it ranges. It ranges with degree of preparedness at LCPGMS or for that matter, we have I'm an AIMS alumnus at AIMS New Delhi or PGI Chandigarh or institutes like this is pretty well because all the consultants or even paramedics are very up to date and they are abreast with latest technology either way, whether it is telehealth or not, movie health or not, telemedicine or not, teleconsultation or not, they're either way using technology. And I mean, we the SGPGIMS are the only public health tertiary care institute in the country who have got everything online. Not even AIMS Delhi has got that thing. So in terms of the healthcare providers being enabled or being technologically literate, so far as telehealth or telemedicine or teleconsultation is to provide it, I think we are much better placed. And gradually, with the advent of NHM and support from NHM and couple of other quarters, the few district hospitals, I mean, I keep on going for inspection assessments. I have seen they have however small, but they have good teleconsultation unit wherein they have got trained people to take care of this dimension of telehealth, providing telehealth, and they are doing it well. But of late, at the end of the day, if you look at the entire country, the length and breadth of the entire country, we are not that well placed. However, the pace of enabling healthcare providers to provide telehealth has been augmented by because of the COVID pandemic, but there we still have miles to go, I believe, and we are yet to have a country wherein we need to have a very good infrastructure or a skeleton or a scaffold to be laid down for delivery of uh, health through telemedicine network or telehealth in years to come, keeping in mind the different geographical terrain, the topology of the country, and the sheer magnitude of the population. This is the way I would like to respond to your first concern.
Yes, sir. Yeah.
And the second concern was uh, can you repeat it again? Second
Yeah, the
concern was
impact of NDHM on the
yeah.
telemedicine, the
This is
national
this is what
digital.
so this yeah this is what when I was concluding the concern with I mean the first concern or my take on the first concern. So I told you,
Yes.
I have been to I have represented PGI in this mission and I have
Mm,
attended meetings in New Delhi. So government is on way to lay down a good infrastructural support or lay down a good network of teletransmission vis-a-vis
mm,
medical or healthcare services in the
right.
entire country. However, they have begun to do it in pockets, and they have also joined hand with the public private sector. There has been PPP initiatives as well
Mm,
in different parts of the country, more so in the southern parts or southern peninsula of the country. And this the digital health mission of the country would definitely bring in paradigm change, maybe in a decade from now, wherein the reconciliation, medical reconciliation, or movement portability of the patient care, or portability of the medical records,
mm.
or seamless transition of patient care across state or centers or level of care would become a reality, and it will help us deliver, I believe, uh, 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 care which is safer, a care which has wide reach, and but at the end of the day, we would definitely miss that human connect. that personal touch, that bonding, that the essence of the clinical medicine, the clinical examination, face to face examination, that we say inspection, palpation, auscultation, all those things. So everything, for every technology, it has its good part and its bad part, and or its merits and demerits. But the way the need is changing, the way technology advancing, I believe there's no other way than to go ahead along with the
Right,
tide.
right, right, right. I'll request other panelists also to share their thought in how this NDHM is going to have an impact on telemedicine. So we can start with Dr. Leo. What are your views on this?
Yeah, NDHM, as made my first talk, I said in August 15th, on August 15th, our Prime Minister has already come up with the clear image that how we are going to trend in the near future. So NDHM can capture a lot of diseases, the disease pattern, and if any tools are used in the disease pattern, we can disease map geographically. So, for example, say in the mountainous regions, the iodine level is very less. Example. So in these particular areas, if you are having an iodine salt, which we can avoid the thyroid related problems. So all are going to be mapped geographically, disease specific, and disease specific treatment. Say for example, in a highway, example in an outer ring road or an outer road, where an accidents have happened or are happening day to day, is on the increasing trend, we can have a trauma set up there, and we can map the trauma and take preventive measures in order to reduce trauma and do a detailed you know root cause analysis with all the ends involved, seeing it's a machine or it's money or it's man or other root causes which can help the society and the nation to grow better in the healthcare. So if your diseases are mapped and it's in a single software, there's nothing like that. There's nothing like that in other countries. With your SSN, say social security number, you are being tracked, or you are being the government knows entire details of you. So similar way, the Aadhaar is also available with us. With the Aadhaar base, if we are able to, map all the diseases and all the, disease specific or disease regions where diseases are happening, it would be very, very great for a healthier nation tomorrow. So I always see this way, and we are growing and we will grow and we will provide our younger generations disease-free environment.
Right. Thank you so much. Dr. Alok.
NDHM had to happen because the way things are changing, there's no way you can stay away from being digitally incorporated and use the technology to deliver healthcare. So, as everybody else has said, portability, it's a kind of record in one place, you won't have a loss of records. So, that's something. See, if you look at the entire country, the everything, there is a banking which is getting digital, there's a payment system which is getting digital. It's like a big jigsaw puzzle of digital map of the country. All jigsaw puzzle pieces are falling in place. The payments are falling in place, accounting is falling in place, the PAN cards are falling in place, so will healthcare. So NDHM was expected, it is going to add value, it is going to make our life easier, and the problems in NDHM will be because many pockets, many hospitals have not invested enough on digital platform. The reality of this country is because the profitability of the most of the hospitals in the country are not as good as the rest of the world. So we do not spend enough money on digitization of our systems. As a result, there will be a lot of blind spots in the country, a lot of blind spots. So I'm sure it's a one step, first step in digitization. And as time will pass by, there'll be more and more steps, and years to come, probably everything will get digitized, which is the way to live in this world. About telemedicine, I just want to add, Mr. Desai, with your permission, that
Sure.
what we are getting out of telemedicine is the documentation. Now, it is not only adding the facility to a doctor and to a patient, it's also allowing us to document e-prescriptions. We can record the entire conversation. That was not happening earlier. We did not know what doctor spoke to the patient. Patient used to say something else, doctor said something else. There were a lot of allegations flying back and forth. With the conversation, we have been able to categorically tell patient that you did not say this, you said this, and it's how doctor has seen you and prescribed. So such things have been addressed. And as you asked some of the panelists about how difficult it is to train manpower, it's rather easy. Technology is so robust, and training people is really easy. You can train them in 4 hours, 5 hours, 2 hours, and especially those who have been working in the hospital. And now they're all familiar with the computer, they're familiar with the WhatsApp, they're familiar with the Excel sheet. So training has become much, much simpler and easy. So the today we are ripe, we are ready to really jump into the bandwagon of digital platform, and NDHM couldn't have arrived at a better time. Thank you very much.
Thank you. Thank you so much, sir. Dr. Divakar, I'll request you also, my next question will be for Sachin Go. But before that, I'll ask for your views also, Dr. G.V. Divakar.
Yes. So NAHM is a very, very welcome move from our recent government recently, which has been brought into the practice. With this, you can collect the data of all over India, what is the prevalence of any diseases like diabetes or hypertension or some other diseases like that. And the messages of Go Digital is loud and clear. This is a very diverse country, and each of the places within the country are bound to have different usage, different levels of acceptance, and different experiences, and so also different impact. So Generation Next is likely to love it because of the convenience and ease of getting a lot of things done at the point of care. So with this digital technology with the NDHM, we can collect a lot of data. We can collect from all over the India, and it is helpful both for the healthcare providers and for the patients to move from one place to other place and show their data like that. In this way, it will be quite helpful for the both for the healthcare providers and the healthcare seekers. Thank you.
Thank you, Dr. Divakar. So, Mr. Sachin Grover, what are your thoughts on the NDHM? You're on mute again.
Is this better? Can you hear me? Thank you. So
Yes.
I think NDHM, I feel it's a great move. If I think of what all it comprises of, right? We are talking about having the right one ID for each and every patient who is coming in. We are talking about a backbone which is linked to Aadhaar and all the documents which are pertaining to the prescription, as Dr. Alok was also saying, that you have those prescription and they are recorded. And there is complete transparency that is built in, right? Now, if I look at it from banking perspective, right? So banking got a digital backbone to it, right? Then it was important for all the private players to build on that backbone different applications which serve the purpose, right? I think with the NDHM coming in and these things of patient ID, DigiLocker, all of those things being in place, it becomes very easy for other players also to come in and provide those services. Now,
Right.
it will be important for the private players to be pragmatic of what are the needs of the customers here in India. Because frankly, if we try and copy a Western model of telemedicine to India, it won't work, right? What we are talking about is what are the needs of this country. Each and every state has a different need, right? From that perspective, how do we have applications which serve purpose across? I think that is important for the developers to think through and come up with those solutions.
Right. Thank you. One more question for you. How post-pandemic it looks like? I mean, telemedicine market. Post-pandemic looks like it will be robust growth for this market. So, how Philips is looking at it?
Absolutely. I think telemedicine is here to stay. Now,
Hmm.
with the people getting used to it, the behaviors are changing. Even the patients are getting more accustomed to this mode. They will be looking at this option far more easier than they used to earlier, right? And if I go back, let's say, to the time when the 2000 rupee notes, the 1000 rupee and 500 rupee notes were banned, that was a immediate a peak that the banking sector saw in digital payments. I think we will remember this 2020 also as one of those pivotal points that we'll remember for this adoption of telemedicine going into the future. That is how Philips is also thinking of more and more work that we do in that space. We are always looking at what is the true value add to our customers, the hospital managing directors, as well as the clinicians who are here on this call. I think we also always look at taking a feedback from them and understanding what is important for them, and then coming up with solutions, right? And that is where the initial two solutions that I was speaking about, more on mother and child care as well as on tele ICU. I think those are two solutions which came out of this need of providing care. And I think we will continue to innovate and do more in that space.
Thank you so much for to everyone for sharing their views in this panel discussion. One last question: any one big challenge while adopting telemedicine consultation to patient? I'll request everyone to uh, share this in 2 minutes each. I'll request everyone along with a concluding remark. So we'll start with Dr. G. Divakar. What is the one big challenge that you see when it comes to telemedicine? And your concluding remark in 2 minutes, sir.
Okay. I think we need to build a capacity of doctors who are in towns where they are not so tech savvy, and so also the senior doctors who may need some help in learning this. And second thing is the use of artificial intelligence to facilitate the rapid scale of this platform. Third is the transparency and advocacy and data security.
सुना ध्यान से, एक
So
क्वेश्चन पूछा,
this,
सब क्या बोले, हम क्या बोलते हैं?
with this you can make use of all these things, and definitely it has got a future, good future, because it will both helpful for the safety for the patients and for the healthcare providers, doctors also, in this COVID times and the post COVID times also.
All
Thank
right.
you.
Thank you, sir. Dr. Marvin Liu, your views
Yeah.
and concluding remark.
So basically, as Dr. Divakar also said, the adaptation and adoption would be the major, challenge. But soon we have to learn. Change is the only thing which doesn't change. So we have to be adaptive towards the change. So we will change. And digitalization of so many things is already happening. Not only your telemedicine, ICU and other things. Records are also getting into systems now these days. So the challenges would be your NDA and non-disclosure agreements, because if there is a breach in your Aadhaar or your platform, your health data can be stolen. That's a major threat to the country, as such. So if that is being taken care of, I'm just seeing on a broader aspect, not on a minuscule, on a miniature towards a hospital. I'm just seeing towards the nation. So if that NDA is, correct and reformed, and because everything has an RTI and everything can be accessed. So it should be very, 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 minimal access needs to be given to that. If that is there, that's the biggest challenge, is what I fear, because it's a false evidence which is appearing real, but we have to be very careful on it. That's the biggest challenge. Thank you.
Thank you. Dr. Alok Roy.
I think the biggest challenge is the mindset. The mindset, that's the reason why the telemedicine could not grow in last 20 years in this country. The mindset of people, those who seek help, because most of them look for a branded doctors. And the
Hmm.
problem with the branded doctors, they don't have time. So time management for the high branded doctors is a big issue, and the people seeking branded doctors. Otherwise, just anybody seeing anybody is not a problem at all. So this is one challenge which is primarily the reason why this did not succeed. Second thing which I think is very important is time management. Our doctors are used to, they're not very disciplined when it comes to seeing the patient. The senior doctor, the more senior he becomes, he has less and less time. So what he does in his chamber is completely unknown to anybody else. He does in 5 minutes and ask him to go. Whereas telemedicine is something which people are watching, connecting, linking up. So their particular slot is blocked for him for 15 minutes. Sometimes the entire discussion gets over in 3 minutes. But the very fact that he has to ask a lot of questions and the time it takes for records to come up and to upload it, to download it, those are very serious issues. So I think at this point of time, we all are thrown into the cauldron of telemedicine because of the pandemic. We will see once the pandemic is over what is the real mindset and how, because what I remember that we find people who are smoking and did their CABG bypass surgery, and after that we told them never smoke, and they promised that they will never touch cigarette. After 3 months, we catch them smoking in the mall. So let's see the how the mindset changes once the pandemic is over.
Right. Thank you so much. So I'll request now Dr. R. Harshvardhan to share his views and concluding remark from his side.
As I understand, you have raised the concern that what is the biggest challenge before telemedicine?
Mhm.
So I would again dissect it. Challenge from whose perspective? From the perspective of provider, from the
Yes.
perspective of seeker, from the
Mhm.
perspective of manager or administrator.
Right.
Again there's another way to look at it. Challenge at what level of care? Primary level of care, secondary level of care, tertiary level of care, or quaternary level of care. There's another way to look at it. Challenge in developed countries or challenge in developing countries. So there's many ways to look at it. What I could foresee, keeping in mind the experience lying behind or before me, is that as so far as primary level of care in developing countries concerned, telemedicine is going to play a role in making the people who can't reach out for whatever reason or variable can have an access to specific care over telemedicine. At the same time, the telesurgery will remain a remote possibility for them. Again, for teaching, training, capacity building, skill inculcation, tele this teletechnology is going to play and is actually playing a very tremendous role and will continue to play the same role. Third, from the perspective of tertiary care, I don't see any much of change because at the tertiary level of care, things are very complex, wherein I don't think that telemedicine would be subserving any interest at the tertiary level because it has to be individual specific and it's going to be a teamwork. Multiple level of care is involved and multiple specialties, super specialties are involved. Wherein I mean, there's no role of telemedicine as of now, and don't see any role in years to come. Now, if you look at it from the perspective of healthcare provider, from the perspective of healthcare provider, it's more of a matter of the necessity, the statutory mandate, the the tele tele literacy, and
Mhm.
obviously adapting and adopting. So as the landscape will change or evolve or emerge, people will have to attune themselves for the same. This is what is I look at from the perspective of a healthcare provider. If I look at it from the perspective of healthcare manager or administrators, then I would, from the perspective of developing countries, it would be the funding, the budgeting, the resource, because it's a capital intensive project. So we'll have to join hands with the public, and in whatever little is happening in our country is by I think I would say it would like 30% from government sector and 70% is from the private sector. So that is the way I look at it from the perspective of healthcare managers or administrators. When you look at it from the healthcare seekers perspective, it would,
Mhm.
for the level of primary care and for the level of secondary care, it will make life better for them. But it will save on them their time, their money, and many more things. Like it will help in their follow up. Even if something has been done, diagnosed and treated at discharge at tertiary level of care, the subsequent follow up can very well be done through telemedicine network, and we are also planning it the same at SGPGIMS. And now, when you
Okay.
look at it from the perspective of the developed countries and developing countries. So the population, the per capita income, the literacy, both in the seekers and providers, both is much at variance. So it would take time for us to reach, to equate, to be in symphony with those who are ahead of us. And you told that we have to give a concluding remarks. Medicine has been a science which has come out of, has born out of sympathy and has been conceived in necessity. So whatever technology comes, whichever way or whichever shape it's going to take in years to come, the human touch will always remain irreplaceable. Thank you very much.
Yes, yes, yes. Indeed, insight.
Mr. Can I tell you something, Mr. Desai?
Yes, yes,
If
please,
you permit.
please.
One thing I would like to comment on, that today telemedicine is playing a role in every sphere of telemedicine. It's not that just primary and secondary are only two. I don't want the participants to go away with the thought that's only meant for the primary and secondary. Like in today in the EICU is very established concept, and it is not secondary care. It's far, far beyond secondary care. So telemedicine is a tool which is applicable in every sphere of telemedicine. That just wanted such a comment which I thought probably will clarify issues.
Yes, of course. Thank you, thank you. Yeah, Dr. Leo, you want to say something? Yeah.
Just a 15 seconds. I want to just add a point for Dr. Harshvardhan. So the main thing which he concluded was the human touch, because we from medicine we only touch patients and then diagnose diseases. But all of a sudden we are in a hold right now where we are not supposed to touch patients, where the patient needs to sit at a 1 meter distance away from us. So all that is pushing away patients from the doctors also in the remote aspect one way. And in medicine, from the anatomy till your medicine and your post graduation, you are supposed to touch the patients and see them. That's when you learn, and that's when you learn the diseases. So a small chapter also needs to be incorporated in our medicine textbooks or any other community medicine textbooks about telehealth or telemedicine, which needs to be incorporated in doctors, because doctors, as we are only been taught to touch
12 new
patients and
modules
treat
have
them.
12 new
So
modules have come
that's
up in
when we come
MBBS.
out of
It
the
is one
outer
of
world.
them.
Yeah, so when we come to the outer world, the world is somewhere far ahead of what we study in MBBS or the medicine, because all medical colleges are not that tech savvy. All government colleges doesn't deal with tech savvy, and we all only see patients. We go see patients, clinical rotation, all those programs. When we come out of the college and we see corporate hospitals and other modernized hospitals, uh, when I came out, I felt that I was nowhere in no man's land. That it was so tech savvy that we have to adapt very quickly. The world is going so quick. So that is one of the challenge. That challenge we need to
Yeah.
incorporate during your medicine course itself.
Right, right,
Thank you.
right, right. Thank you, thank you, thank you, everyone. Sachin Grover would like to say something. Yes, yes, Mr. Grover, tell.
Yeah. Yeah, I think it's a very interesting point that Dr. Leo also pointed out, right? From the college days to actually
Hmm.
practicing, we see a sea of change, right? I think telemedicine will see a real good adoption when this is
Hmm.
getting adopted in the college itself, where students during their
Hmm.
MBBS days as well as during MD or MS, they adapt to it, they learn, they see it actually, and get comfortable with that
Right.
technology. I think that's the big shift. Secondly, to the point that Dr. Alok and Dr. Harshvardhan were also talking about, what are the big issues in the tele adoption, right? The way I think of it, I think there are two players in it. One is a government player, the other is private players, right? Now, for government, they need to figure out where the money is going to come from to adopt this technology, right? To get this technology far pervasive into the interiors, right? For the private players, what is important is that the business model that is looked at, it makes sense for everyone, right? The business model is built on who are the stakeholders in this entire, when we lay it out, and how does each individual stakeholder still has a business model which makes sense. I think till the time this business model is worked out for all stakeholders, we will continue to see more experiments, maybe more failures, learnings coming out from failures, and then reworking on those business models. I think that is very important for the private players to look at how do they get into a tele medicine. While teleconsultation is very well adopted, I think everyone knows how this is going to work out. But as we expand the scope of telemedicine beyond teleconsultation, and as Dr. Alok was saying around tele ICU as well, how do players in all of this actually have a right business model for them to work?
Right. Thank you. Dr. Divakar, you also wanted to say something. In 1 minute, sir, if we can please
Yes,
comment.
definitely. Since I'm in the teaching profession from last 30 years, nowadays I'm seeing younger generation students, they are more adopted to this telemedicine and that Zoom platform presentations, everything. And definitely they will progress because in our older generations, we never used to or exposed to all these things. Nowadays they are exposed to all these recent technologies and they definitely get used to this. And lastly, I thank the Elite Technologies for inviting us for this panel, and it's a very good panel discussion. I thank all the panelists. Thank you.
Thank you so much. Thank you so much, everyone. So, I mean, it was a good panel discussion, and telemedicine has become a fundamental piece of the Indian healthcare system. And since coronavirus outbreak, among many things that have changed is telehealth position in healthcare delivery. So, with the increasing public appetite for the healthcare options that offer a safe and convenient method of seeking care, telemedicine has indeed seen a sharp rise. And this is in future also this will be a very effective tool in the entire healthcare ecosystem. So thank you so much. We have also been joined here by Karthik Sharma. He is the eGov and eHealth vertical head at Elets Technomedia Private Limited. And now, before we end the session and before we award the certificate to all the panelists, we are going to launch our magazine, which has been, which is eHealth is the monthly magazine that is brought out every month by eHealth, Elite Technomedia Private Limited. So, rebuilding healthier nations, we have covered some of the very great interviews, articles, guest columns, and stories in this edition. And I'll request everyone to please subscribe our eHealth magazine and also contribute with their columns and articles. So this is one of the magazines which is read by healthcare professionals across the country, and we enjoy a huge readership. Thank you. Now, Healthcare Transformation Summit, a brainchild of Dr. Ravi Gupta, who is the editor-in-chief at eHealth Magazine and chief executive officer at Elite Sector Media Private Limited. And of course, Karthik Sharma, who has been working on this project since the day one, along with his team. We have couple of questions more for today, but we can certainly say, and we are glad when we say this, that the Healthcare Transformation Summit has been a huge success. We had a number of esteemed ministers joining us, government officers, private players, and several esteemed key speakers from different hospitals who have taken time out from their busy schedule and participated today. So, uh, considering the success, keeping that in mind, and we have been told by many stakeholders also to come up with the second version of this program. So we are going to launch uh, the Healthcare Transformation Summit's second edition, uh, which will be organized on 30th and 31st October 2020 under the guidance of Dr. Ravi Gupta and Mr. Karthik Sharma. So this is what we are going to again organize on 30th and 31st October, and I'll request every one of you to also please consider our invites for the same. I would request Karthik Sharma for closing remarks from Elit's Technomedia side. Karthik.
Uh, thank you, Harshal. And I thank all the eminent panelists from various hospitals and healthcare stakeholders, and from a corporate side from Philips. So I thank all of you to make this session actually really interesting. I was at backstage, I was watching it, and it made me know a lot of things about telemedicine and how telemedicine is going forward in India. I am now totally aware about it through this session. So I thank all of you, and I request you to join us in the next edition also, and looking forward to see you. And thank you so much.
So,
Thank you all.
Rajeshwar,
Thank you very much.
yeah, we would like to
I
present the
Thank you, everyone.
certificate of participation. Sachin Grover. Thank you
Thank
so much,
you.
Mr. Grover, for joining us.
Thank you.
Dr. Alok Roy, CMD of Medica Super Specialty Hospital. Thank you, Dr. Roy. Dr. Mervyn Leo, Aware Glen Eagle Global Hospital. Thank you so much for joining. Certificate of participation to Dr. G.V. Divakar, Managing Director at Divakar's Specialty Hospital. Dr. Rajesh Harshvardhan. Thank you so much, sir, for joining us today.
thank you very much for bringing us together, and it was good to interact with a wide range of brains. Thank you very much. Thank you all.
Thank you. So thank you once again. And with this, we formally close this session. And if you want to join the next session and listen to the next panel, please do that. We are live on our website, which is htelletsonline.com. Thank you so much.